welcome to another segment within Nairobi Hospital. Today we'll be talking about prostate brachytherapy, a treatment option for prostate cancer. And taking us through that discussion is Urologist Dr. Maina Kanyi. Karibu sana daktari.
Thank you.
So my first question to you will be, what is prostate brachytherapy?
Prostate brachytherapy is the use of radioiodine, which is a metal, fixed in the prostate, and that cures the prostate cancer and leaves the male as well he was created, with no side effects that are going to affect him in his life. And this is not an operation that cuts the prostate at all. We just put those small pieces about 3 millimeters in length, putting into the prostate, and thus they burn the cancer cells. This brachytherapy is not only for males. We have also used it a lot for the females, the cervix. See, if you compare the male and the female, the prostate is equivalent to the cervix, such that prostate cancer is just the same as cervical cancer. We use the same material, and this leaves our patients very, very happy because they have not been operated and their cancer is being treated.
And how common is this procedure in the treatment of prostate cancer and its level of effectiveness?
Prostate cancer, we are a bit selective in terms of the people who qualifies for the prostate brachytherapy. Brachy just means getting those seeds, but we use it for people who have earlier prostate cancer early, or even the cervix early, not the disease that has gone and spread to, for example, maybe around to the bones or going to near the other tissues around the prostate. It cannot be used. So we use it a lot for early prostate cancer.
And what are some of the side effects of the prostate brachytherapy to the patients?
When we are looking at prostate cancer, we look at early cancer, some which is in the middle, on advanced prostate cancer. Early cancer is the cancer that is within the prostate and has not spread outside of the prostate. The prostate is like a tortoise which has a cover, a shell around itself. And prostate cancer initially remains within the prostate, and it is staged like stage 1, stage 2 to stage 3. Up to stage 3, the cancer is within the prostate. That one we can do it. Now, to diagnose prostate cancer and to do all those things, we use a hormone called PSA, prostate specific antigen. And this PSA is very, very important because it comes and it is measured. The normal PSA is 0 to 4. It is measured in a measurement called nanograms, prostate specific nanograms. And when we do that, we can see who has the prostate cancer. In normal, we have 0 to 4. Maybe if you took for me, it may be 4, it will be 3. That is normal. But if it is above 4, we are suspicious about prostate cancer. And that is when we can go and take materials from the prostate with a needle and then take it to the laboratory and check for prostate cancer. That is how we are going to make the diagnosis and say this one is early. If the disease has gone out of the prostate, then that is what we say it's advanced prostate cancer. And that time then we cannot use this, what we are calling brachytherapy. We may have to ask the patient to have an operation to remove the prostate. But sometimes when we have put in those seeds, iodine seeds, we may have to do what we call radiotherapy. If we find that the disease is a bit advanced, or it could be advanced as the patient goes on, we add radiotherapy to brachytherapy in a few patients.
As much as we have the side effects, there is also the clinical benefits. So what are the clinical benefits and also the success rate of the treatment?
See, the brachytherapy is the best treatment for prostate cancer. And because when you put those seeds into the prostate, it is like you are burning all the cells that have cancer in the prostate. And the patient remains as he was created, like I had mentioned before, so that he does not need to have other medicines at all if he can come early. And when it has been done, the patient is cured completely. So he does not need to go to the hospital for medications or radiotherapy. That is why we would want the males to tell them, please have your prostate cancer test done, PSA, prostate specific antigen, checked. It's just a blood test. You go to the laboratory. You don't even need to meet a doctor. You just go to the laboratory and tell them, please, can you do my tests and let me know. And those people who are a bit older, over 40 years, they should do it every year, because you know that, we may know that prostate cancer is the #1 killer of cancers in males. So the ones we have done in this hospital from the 2017, we have not had any side effects that are going to prevent the male for his function or even doing his work or what he does every day. He can do everything that he can, because this brachytherapy is put inside the body and it kills the cancer cells. So there is no pain that he's going to feel. There is nothing that is going to migrate anywhere that is going to have. It just starts working and killing the cancer cells. But when we are giving this radiotherapy, we have to be careful, because radiotherapy, I have a young child, maybe from my children, for example, who comes to jump into my lap. You see, I have to take care that they don't come when the first week when I have been given this brachytherapy, because it can burn that child with the reproductive organs of the radiation of the testes. If it is my grandson, he comes. So I have to tell them, when you have done the first week, do not go and start having your grandchildren, jumping at you and you are happy. You have to keep away. That's the only side effect that we can have. But this iodine does not come out once it has been put.
Is this procedure available at the Nairobi Hospital?
From 2017, when this was started in Nairobi, we are the only people who have it in this region, Eastern Africa and Central Africa. We are the only center right now. We started in January of 2017. That is when we had the first session of treatment, and we paired up with a German team who had taught us how to do it. And so far, from 2017, we have over 100 patients, and we have not had any problems. Very few have required an extra radiotherapy. But you see, when you select those patients, if the prostate is very, very big, they cannot have the medicines, that type of medication. But those who have early prostate cancer, and the prostate is not very, very large, any prostate about 60 grams or 70 grams maximum, we can be able to do it. And of course, most males will fall into that category. From the start of 2017, NHIF has been supporting this treatment, and they were paying up to 500,000 for the patient. But the total sum that the hospital has charged was 850,000 for everything, paying for the seeds, the accommodation, paying for the doctors who pay it. Everything that is done, that is the amount that the hospital has charged. This machine is the one that is computerized, and to put the seeds, you use images so that you look at the prostate size and how it is. It has lobes, left, right, middle lobes. All those are there, and then we know how much tissue are we going to cover. This machine is the one that shows us when it is put in the anal area, it shows us the prostate. And therefore we can see how much is the prostate, what is the area or the volume of the prostate. And so we can know on the right, we are going to put maybe 10 seeds or 20 seeds, the left, so many. So that is what we do. So we use these machines. It is not guesswork. You use computerized work so that we know it, because when you work, you want to avoid complications. What complications would come? You see, these seeds, if you put them so close to other organs like the rectum, GI shaw, then you can have a hole in the rectum, and therefore you will have a leak of stool, which is not good. Or you can see this seed can go into the pipe for urine, the urethra. You see this one now, again, you will start putting radiotherapy into the urethra, it will be bad. So all these things are computerized. The other thing is this disease also sometimes comes in with the families. If the mother of this man, who is now 40 years, had breast cancer, about 2 to 3 times, he may of the risk he has, more to 3 to 4 times risk of prostate cancer. So when he is 40 years, he should go for cancer test. This brachytherapy, it is good because it leaves him as created. We are not removing any parts of the body. We know when you remove the prostate completely like this, and you remove a piece of the urethra somewhere here, these people will have problems. One problem will be they will not be able to, even if they wanted sex life and you have removed the prostate, they cannot have further children now because you have already removed the pipes that bring the semen bring the sperm from the testis all the way here. That one has been removed. So now they cannot. 2 is that the urine can also be affected because the urine that is going to come here, and you have removed most of this now, you are not going, it will be coming maybe through quickly, and you may have to use some cloth so that you can get the urine not to be so much. And these are some of the things that we want to the males. Please do it early. Let us find your diagnosis early so that you are not operating. Brachytherapy, you are just leaving the prostate intact. We are not removing anything. If you walk today to Nairobi Hospital or to even any other hospital and say, I want to do this test, you are allowed, and then you just go ahead. So we don't have to even go to the doctor's office. Just go and do the test. And the hospitals, government hospitals have all those things. If we did that test, we will catch this disease early. So all people, young people who are 40 years, 45, they should start doing it.